one of the most fascinating things on ultrasound, and you don't even need color Doppler to see this, you can actually watch the blood flowing through the veins on ultrasound. I mean, it's the most interesting thing you've ever seen. You just watch it marching along. And you will see that it changes when people breathe. If you take a deep breath, a lot of times it will move the blood faster. There's just a lot of interesting things you see in ultrasound. You learn a lot about how your body works looking at things that way. Yes, ma'am?
Does exercise like walking or vigorous exercise help or harm if you have something?
It's going to help. It's certainly not going to harm. So exercise is fine. Okay. Yes, ma'am?
You mentioned this cold feet that look like they had stopped all the time.
Yeah.
What do you do for that?
Well, basically you treat the underlying vein disease that's causing the problem, and once you treat the vein disease, a lot of times those things will reverse. Anyone else? Yes, ma'am?
You mentioned darkening veins around the ankles.
Uh-huh.
Is that just a hereditary thing, or is it caused by any particular problem you might have?
Well, what we talked about was the darkening of the skin around the ankles and feet, where it looks like somebody has socks on.
Well,
And
this veins that have gotten darker around the ankle.
right.
And I noticed my father had that.
Mm-hmm.
I don't know whether there's any symptom.
Well, usually darkening of the vein, when you see veins that darken, a lot of times what you're looking at is you're looking at the pigment from the blood, where blood has seeped through the vein walls, and then the body comes in and starts to digest it. And the body uses little white blood cells called macrophages, and they literally will gobble up all they can eat, and then they start to move away. And you'll actually see the area around the vein darken. Sometimes during treatment we see that. It's called staining because the body's cleaning things away. But you can get that even without that, just with bad vein disease. Yes, ma'am?
What is it if there's no discoloration, you can repeat a normal color, but what your socks are, and it looks like they're really tight, but they're really not because the swelling goes away. You know, like if you're wearing boots, you see right where the boot is?
Right.
I mean, are my boots too tight or what is it? What's going on?
Well, I mean, most of the time when you see that, there is some degree of swelling. And so what you're doing is you're putting support around an area, and then when you take your socks or your boots off, then you're going to see an indentation in that area. I mean, I can tell you I work out at the gym all the time, and when I finish working out and I take my gym socks off because they're relatively tight, you can see where they were. And I had Lewis look at my legs on the ultrasound one day, and I actually have vein reflexing the wrong way. And that's why I'm having a little bit of swelling. So, I mean, that's what that means.
Is that an issue though? I mean, could it become an issue?
It will gradually get worse over time. And you know, if you were to use support hose and try to do things to help as much as you could, that will delay that problem.
Okay, that was my next question. With the support hose, what kind of support hose do you normally use?
Okay, well, any grade of support hose is going to be helpful. So, you know, there's a very well-known company that makes support hose called Sigvardis. And they make, I know they make for men, and I'm sure they make for women, casual support hose that look like, you know, casual attire.
But they're not pantyhose, right?
I'm sure they make pantyhose too. We also, now we use medical grade support hose when we do these procedures, and that's some serious support hose. I mean, it's hard to get those things on. But that's, and when we're doing treatments, that's what we use, and we use it for a couple of reasons. One, we use it because it minimizes complications after treatment. The other is it makes people feel much better. I mean, when you're treating somebody's legs and their veins become inelastic, like I was explaining before with the joggers, they feel pulling. you put those support hose on and all that's gone, because you're adding support to the vein, so it's not going to pull against those adjacent tissues as much. But you know, you don't have to wear the support hose that's this thick, you know, all the time. But yeah, any kind of good support hose, if you're in an occupation where you're on your feet a lot, it's going to be very helpful. All right. Thank you for having me today. I'm happy my mom didn't have a baby while we did this. If you ever have any questions, you can feel free to call us over at the Med Spa, and then otherwise I am going to turn this forum over to our hostess.